This is the vastus lateralis on the outside. The vastus medialis is the inside here, right?
It's the middle one.
Yeah,
You can
so-
see it good
Yeah.
on our evidence because I separated them out. Lateralis, medialis, gracilis.
Okay, I'm gonna
so
separate that
flat.
some. And then let's see, this is the gracilis on top here. The abductus longus I think this is the first one right here is abductus longus.
Longus is the one all the way up here.
Yeah. Abductor brevis
Brevis,
is this
Magnus.
one. Magnus. Then
This is the
semimembranosus.
and the semitendinosus is underneath.
Is this one right here, right?
It's underneath, yeah.
Yeah, this one right here is the tendinosus. And then the tibialis cranialis is the shin bone. Right there. The Achilles tendon is back here. The
Wait, which is it?
Yeah,
the gastrocnemius.
is this calf muscle. I can think of here. And then the biceps femoris are, yeah,
Big one.
It's underneath. It's like right below.
these right here, right?
Yeah, it's right below the glutes. Like these
Yeah.
are glutes. This is the bicep femoris.
Femoris.
This area.
And then the gluteofemoralis are these. Is the one on?
The femoralis is the one closest that touches the.
Medius is the top circle.
This one right here. And then the
The
femoralis. one?
triangle is the medialis, and the one that actually touches the biceps femoris is the gluteofemoralis.
Yeah. So the femoralis, I always remember it's like a triangle.
Okay.
Medius, superficialis, medius, superficialis, and then femoralis is on kind of the side.
Okie dokie. And then the gluteus superficialis and the fascia.
The fascia latae. She said she wasn't going to pin that.
Yeah,
right?
she can't really pin that, but that's what it is. Now the latimus dorsi, that's the ones on the side. She can pin it on both sides. It's like coming in on both sides, or she can bring it up front on the belly side. And it's coming in through here. And the lumbodorsal fascia is all this here. And the longissimus dorsi, if you open this flap, this all right here. And then the multifidus is the spine right underneath the fascia right here. Where I'm moving that. And then the trapezius thoracic are the wings here.
Ours is pretty good. You can actually
Yeah,
see the
you can
wings.
actually see them here.
It's the trapezius
And
thoracic.
then the trapezius cervical is underneath. Did she break ours?
No, she broke our arm. See,
This is like coming apart.
it's up
And
here.
then the supraspinatus, those are the ones on
It's the top one, the bigger one.
Yeah.
The super,
Super.
and then the supra
And
is the little, or infra. It's
Infra is on the sides.
on the side there.
And then the teres major, if we go this way, is this muscle deep down in here. Right there. And then the serratus ventralis are the little gills right in here, little ridges. And then we have the rectus abdominis,
It's no longer there.
which is no longer here, but if we were to close this, it would probably be about this right here. And then, what do we have? Linea alba is the imaginary line. She can't pin that. External oblique is all this on the outside.
She would pin your little flap though.
She might, but she said if she was going to use a flap, she was going to use the internal one. This is the internal oblique right here. And that's
Hey, a guy can hope. A guy can hope.
Let's hope. And then the pectoralis superficialis is all this up here. And then the bicep or pectoralis profundus is the one
Under the flap.
underneath where our flap is, I think, is underneath here.
Do it again.
It's underneath the flap of the superficialis.
And that's the
Pectoralis profundus. And then the biceps brachii up here, triceps brachii here, masseters are here, digastricus. If we look here, the little muscles here and here, and the sternocephalus are the muscles on the side here, here, and here. And the mylohyotis is a little triangle up here, and the sternohyotis is this right here,
Covering the
which
trachea.
is covering the trachea and the esophagus. Now, subclavian
Okay, let me
artery.
try. Subclavian is the one that branches off of the aortic arch. It's before you get to the axillary vein. Well,
So
not vein, I
it's-
guess, but
Where is it on here? I can't. You got to hold that open for me. Okay, so where is it? Here, you pointed
The
this
red.
one.
subclavian is going to be the blue. It's a vein. It's going to be the blue on the right side. So the rabbit's right is here. It's going to
So is
be
this
this
one?
one here. It's on the inside of the axillary. So anything past that's going to be the axillary vein. So that's going to be your subclavian. And this red one here is going to be also your subclavian artery. So there's subclavian vein and subclavian artery. And they're right there. What's next?
The right and left jugular.
Jugular vein.
It's up at the top there.
Yeah.
It's blue.
It's here, right? Is that it?
I think so.
That would be the right, the left. You've got some like blue going up through here. I'm gonna assume that's it. It's probably this one right here.
Yeah, that looks like it would be the jugular.
This is it.
Left, and then the right is like this huge splotch.
And then the carotid.
Carotid is gonna follow the same pathway. It's probably this red one here.
Yeah, it is.
The aortic arc.
We'll switch places with you.
The aortic arch there.
And then the inferior vena cava is going to be underneath, I think, all this.
Yeah, it's under. It's the one that's.
I move this
straight
right
from the
here. Yeah, it's moving down here underneath.
It's the blue one,
Yes.
yeah. Inferior vena cava is the blue one.
And then
The abdominal aorta is the red one, right next to it.
So right and left iliac.
the iliacs are going to be
Branching
down
off before the get to the leg.
before, yeah. They're branched off somewhere.
It's probably these ones here. Or actually,
They would be
it's
more
actually
down,
probably down here, yeah. These
Right
ones
down
here.
Yep, and then anything after that is the femorals that come
It's
down
right here.
here. And then the renals are going towards the kidneys,
These
so
ones here.
those big ones right there.
And that's the right side, and then the left side as well.
Show the renals again.
This is
the
the
right.
rabbit's left.
Oh, left, yeah. I keep
Left.
doing it because
That's
it's my
the-
right.
yeah.
It's the rabbit's left side, renal.
Renal. Okay.
And then his right side is under all this junk.
Okay.
Right in there.
It's down here.
Okay.
Okay, and then the atria and ventricles and the axillary. That's all in the heart. So
These are your atria and your ventricles. Left atria, right atria, left ventricle, right ventricle. And there's that line. I can't remember what she called it.
the innomen. No, that's not it. I don't know what you
I don't think it's on here though, but I think it's just something that she used to try and like help us divide it.
Yeah.
She didn't say right at all. It's not written.
Yeah. What we got left? Organs now?
Yes, organs. Those are the easy ones. Right here, big peanut right here is our kidney, urinary bladder, a little thing right here. Yeah, gallbladder.
Gallbladder is up underneath here. Here, we'll use mine because I already ripped it off. It's right here, this little
Okay, so it's
green bean.
underneath. It's
This is the liver here, and this is the gallbladder. It's a removed piece of the liver.
I don't know if we can find it on ours. Oh,